MDA Chapter 49, Matrix Systems for Restorative Dentistry. Dental matrix system. So our matrix or our matrix is going to provide a temporary wall for the restoration process in our class 2, 3, and 4 preparations. Remember, these are the classes that include our interproximal walls. So the benefits of using a matrix system are to stabilize and hold the material during placement, hold the dental material during the set time and curing, to restore the interproximal and anatomical contours, restore correct interproximal contact with adjacent tooth, and to create a smooth external surface. Our posterior matrix system is going to include our Telfamire retainer system. This is also called a universal retainer. This will hold a matrix band snugly in position, and it's positioned most commonly from the buccal surface of the tooth being restored. We also have the option of a retainerless matrix system. This secures the band for the missing proximal wall without the retainer. When using a matrix system, we will also use wedges. These are inserted into the lingual embrasure, which is just the space between the two teeth, and it holds the matrix band firmly against the gingival margin of the prep. Wedges are made in various sizes and forms, triangular or round, and they're also made of different materials, wood or plastic. Considerations for wedges: they must be wide enough so that the pressure is applied to apical and gingival walls of the preparation. The wedge presses the band against the tooth and causes a slight separation of the teeth. It's going to be slightly wider than the distance between the cervical portions of the adjacent teeth. This is to create a seamless transition where the tooth and the restoration meet. In our interior matrix system, we use a clear matrix. We're going to use this with our composite resin or our glass ionomer materials, and this will be used for our class 3 or 4 restorations when our proximal wall of the anterior tooth is missing, and no retainer is needed to hold the matrix in place, making the system an easier application. The purpose of the anterior matrix is to be placed interproximally before etching and bonding of tooth, and this will help to protect adjacent teeth from these materials. After the placement of the composite material, we can pull our matrix tightly around the tooth, and this will help to create a natural contour. And then with it being clear, this is going to allow us to cure and penetrate the material. Some alternative matrix systems that can be chosen are our auto matrix system. No retainer is used to hold this band in place. And then when we're working with primary teeth, your provider may choose a T-band system. Important to note that with the auto matrix system, a wedge can still be used. With the T-band, majority of the time, a wedge will not be used.